We're here at the American Heart Association meetings in Orlando. I'm Dr. Kent Meredith from the Intermountain Heart Institute, and I have Dr. Geng Zong, who is from Harvard School of Public Health, and he works in the Department of Nutrition. Dr. Zong, tell us a little bit about your study. You were looking at the number of meals a person consumes at home and whether that helps with the risk of diabetes. The idea, of course, being that if you eat more meals in restaurants or fast food, that perhaps you're more at risk for diabetes. So what did you look at in your study?
Yeah, actually in this study we look at the risk of diabetes in about 100,000 participants. We followed them for 26 years. We found the frequency of having meals prepared at home is associated with a lower risk of diabetes. And we also found that having meals prepared at home is associated with a lower risk of obesity and weight gain. When you adjust for obesity, the association between meals had at home and diabetes risk become weaker, which means obesity could be a mediating factor between having meals prepared at home and the risk of diabetes. We also look at several dietary factors that could possibly influence diabetes risk. And what we found is sugar-sweetened beverage intake, which I should say soda consumption, which is lower among participants who eat more meals prepared at home could be another mediating factor that influence the risk of diabetes because you
you don't drink soda pop when you eat at home, and maybe that's a factor in this.
Yeah, that's right.
Any other ideas about why eating at home might be healthier or might prevent diabetes?
Actually, we should look from the other side because there's a growing trend of eating meals prepared out of home in the United States and many countries. This is because socioeconomic changes. And the meals prepared out of home, they're usually low in diet quality, such as high in saturated fat intake and high in sugar-sweetened beverage intake and high in energy as well. So I think that's why when we look at the meals prepared at home, they will be inversely associated with the risk of diabetes.
Very interesting.
Yeah.
Any future directions that you're going to take this study?
Yeah, actually we are, this is a very unique sample because previous studies focused on weight change in younger people mainly. But in younger people, they will have lower risk of diabetes. So, but our study is very suitable for more severe conditions such as diabetes and cardiovascular disease. And we're going to investigate this for cardiovascular disease in our next study. Thank you.
I think that'll be very fascinating to see how it affects young people especially.
Yeah.
Well, thank you, Dr. Zong, for your
thank you
time.
so much.
We look forward to seeing this research.
Yeah, sure. See you.